in Parliament.
And in our discussion with the Minister, health needs to just come in and indicate there will always be support for the vaccine acquisition program. And so he has given us assurance and cabinet that the vaccines are a priority, that the Treasury will do everything to support. Honorable Dango, BRICS partners, indeed, we have a decision for a BRICS vaccine institute to be developed in South Africa. So there are discussions in that direction, and we believe that this will be taken forward. There is quite a lot of discussion that we have in relation to the particular vaccines. We have our department discussing with the Gamaleya Institute on Sputnik V, and also with Sinopharm and Sinovac on how we can collaborate and work together. Some of them are considering some trials that need to be done together. So we believe that there's a very positive future for collaboration. Then how many vaccines? At the moment, we have bought three. We have bought one set of vaccines. The other two are being finalized, but there's commitment on three. So the first one was the AstraZeneca, which we bought, and that we did indicate, I think Dr. Anban Pillay gave the indication as to how much that was that has cost us. The other two, we're still fighting on the prices and other conditions. We'll announce as soon as we've concluded it. So as soon as that is done, we will then make it public. But at this moment, we're still kind of fighting through a number of those issues. So once it's settled, we'll be able to talk about it. The companies that were engaging immediately is J&J, Johnson & Johnson. It's Pfizer for immediate acquisition. And then we are also in talks with Moderna, with Gamaleya Institute. We are also in talk with Sinopharm and Sinovac. Then Honorable Malega ubuza ukuthi kungabe amakhosi nabaholi bezokholo bazoba nawo yini umsebenzi abazowenza, indima yini abazoyidlala kulo msebenzi wokusabalalisa ulwazi ngale migomo nokuthi sigudlule inkoloze. Sixoxe kakhulu nabaholi bendabuko kanye nabafundisi nabaholi bezenkolo bazosilekelela kakhulu. Sivumelene ukuthi kufanele makusondela isikhathi semgomo bese sikwazi ukubanikeza ulwazi olufanele. So sizobe sibambisene kakhulu nabo. Uhlonishwa uLthuli kuze ukuthi uzogcinwa kuphi lo mjovo, uzogcinwa ubani. Inkampani khona kahulumeni ezoba isizinda lapho sizosebenzela khona ibizwa ngeBiovac, ukubambisana phakathi kwahulumeni nenkampani. Ngakho-ke siyayithemba kakhulu ngoba ivele isebenza ukuthwala inhlelo zokugoma. Ngaleyo ndlela sikubona kubalulekile usiqhube nokusebenzisana nayo. Ibona bazogcina-ke lo mjovo uze kufika isikhathi sokuthi usatshalaliswe uye ezifundazweni. Uma sekufikwa ezifundazweni, inhlelo sizozisebenza ezobe sezihambisana nezakhiwo nezikhungo lezo esizicelile zikahulumeni ukuthi kuzobanjiswana nazo. Honorable Klute raised the same question about the government being the sole purchaser of vaccine and says this is a monopoly. We must say that most of the countries are running it like that. In fact, other countries are even much stronger. They have even determined that no one will get the vaccines until they have distributed them in their own countries. So most of the vaccine, because of the emergency that it is, it has become necessary for government to take a very proactive stance and move ahead in this case. But private sector will be able to have access to the vaccines, and the access will be on the basis of our arrangement and cooperation with them. These vaccines are for all South Africans, whether in the public or private sector. So we want to assure the members that there's an intention here is a good one to make sure that we support all South Africans, whether in public or private, to get the access to the vaccines. Then, Honorable, I think question was, would provinces be able to store vaccines at correct temperatures? Yes, we have actually assessed. We will support the provinces that to make sure that there are facilities that can store the vaccine. We will not deliver to a province vaccines that the province has got no capacity to store. So in terms of temperature requirements, we'll make sure that the provinces are capable of storing those vaccines, and therefore, if there's any need, we'll work with them at that point. Ubuzile umhlonishungwezi umbuzo ofana naloka umhlonishmalenga ukuthi amakhosi athintiwe yini. Sesikhulumile nendlu yamaholi bendabuko, sixoxisene ukuthi ababe seduze kubanjiswane ukuze umyalezo ube utholakale kubantu babone ukuthi indlela esiyisebenzayo inawo ukusekelwa amakhosi. Kodwa futhi sathi uzocela ukuthi bazimisele ukuthi bahambe phambili kube yibona abazothola ukugonywa kuqala ukuze uma inkosi ithi kumphakathi emphakathi sukumani niyeko thola umgomo umphakathi bese uyabuza ukuthi wena nkosi ke busujovile na. Inkosi ithi yebo sengijovile, ngakho ke ngithi nani ningaqhubeka ngoba iyona ndlela esizophephisa ngayo izimpilo zabantu abaningi. Amazwe aseduze komakhelwane zikhona izinto ezingeke zibelula ukuthi sizozinqanda kakhulu ngoba umhlonishwa uzokhumbula ukuthi abantu abasekumakhelwane kuvamise ukuthi ngapha nangapha komngcele abantu abahlobene abayimindeni othola nesibongo nolimi cishe elifane, kungabi lula ukuthi ungabasefa bonke ngaleyo ndlela. Kodwa ke sizokwenza okusemandleni ukuthi abantu abafanele ukuthola imigomo bavikeleke bayithola imigomo ngendlela esizokwenza ngayo. Ngiyokwengichaze leyo ndledlana ukuthi sizama ukuba sisebenzise ziphi inhlelo. Nakakhulukazi kubantu abadala into engicabanga ukuthi ibalulekile ukuthi siyafisa ukuthi sifikelele emakhaya kungabi khona ingxaki yokuthi kunabantu esingafinyeleli kubo. Okwesibili siyafisa ukuthi kungabi khona abantu ngenxa yokudala noma uncipha kwemfundo singabi nayo indlela yokukhuluma nabo. So imiyalezo siyenza ukuthi ibe lula, kube lula ukuthi icace imiyalezo ukuze umuntu odingeka ethintiwe atholakale ukuthi akwazi ukuthola umgomo ngesikhathi esifanele. We will also be utilizing an electronic registration register. We currently have a health patient registration system which has most of our South Africans in there. It will make it easy for us to be able to record who needs to be getting vaccination. We'll also have to use different methods of how we reach out to the communities. So in some areas, we will actually have vaccination centers where we'll invite people to come into the center and get vaccination. In some other areas, we will focus on how people can go into what we call a mobile unit, outreach units that will go out and go into remote areas so that people don't get left behind. Then Honorable Bartlett says this is a lucrative market. How do we make sure that there's safety in storage and protection in transit? We have already considered that is a risk, Honorable Bartlett. The reality is that now we've got the police to be part of the process. So they have made the necessary contingency arrangement to make sure that the storage is safe. They actually convinced everyone that they've got this kind of skill and capacity to deal with such situations, and we've been at this point quite happy with their service. And so both in terms of storage and transit, we are quite assured that there is safety. In addition, we must say as well that there is a team in the Interministerial Committee that looks at this on not only the South African Police Services, but the other departments that are associated have also been invited to participate. We will make the vaccines available to all South Africans and foreign nationals. Largely, it's easy to deal with those, particularly as we're dealing with people with, because there will be licensed people with citizenship or with work permits and so on. So the issue really is that we need everyone to come through and get registered in the process. And so we will then deal with the unexpected situations at the point when we have to deal with them, because we obviously have to deal with the situation that we know what is the problem here. So we will have to deal with the issues of undocumented foreign citizens as we come across them at that point. Then umhlonishwa uBB ukhuluma ngokuthi inhlelo zethu zokusabalalisa le migomo zimi kanjani. Siyawubonga umbuzo, siyafisa ukuqinisekisa ukuthi sizawusabalalisa le migomo kuzo zonke izikhungo ezisemadolobheni amakhulu namadolobha amancane nasemakhaya, sisebenzisa inhlelo zomahamba nendlwane ukuthi zobakhona bazosuka bahambe baye endaweni zabantu babaqoqele ndawonye. Sesike sakhuluma nalokubukisisa ukuthi uma kuyovotwa kwenziwa njani, sabona ukuthi lolo hlelo selingalisebenzisa uma kukwazi ukuthi kubanjiswane kulo. Ngakho-ke siyafisa ukuthi umphakathi ulindele ukuthi sizobe silokhu sibambisana. Kubalulekile ukuthi umphakathi uthembe ukuthi inhlelo zethu zizofika kuwo wonke umuntu, ukuze kungabi khona isiminyaminya mhlawumbe sithi khona kuyaqala kuyajoba abantu bazi ukuthi sizofika nangakubo noma singakafiki ngaleso sikhathi. Inhlelo zokubhekana negilamkhuba, lezo nhlelo lezo nazo siphezu kwazo ngoba siyafuna ukuthi izinto ezithinta ubugebengu noma umkhonyovu engabe ihlangene nalolu hlelo lole migomo lukwazi ukuvimbeka, singabi nangxaki. So nakho lokho siyakusebenzisa kakhulu. Ikhona uhlelo nje esilibiza ngokuthi lapha ngaso committee longqongqoshe ibhekene nokubheka nje nokuthi silwa kanjani nenhlelo zokhohlakala. There is a question, I missed the name. However, it was the same question about why the provinces are not allowed to purchase. We have actually indicated the challenges that the provinces will face, and amongst the issues the provinces will have to face is this condition of prepayment. You need a deviation from Treasury. It's not a simple condition. There are also very serious terms of contracts that the provinces are not capable of negotiating because there are more sovereign decisions. And so we are actually guaranteeing all the provinces that they will be all covered in an equitable distribution, both for public and private sector, for the distribution of the vaccines. So it becomes unnecessary for them to worry themselves about procurement when that will be made already, but what they need to focus on is the distribution. Then the question of choice, where we sit at the moment, we will make the vaccines available on the basis of the recommendations. At the moment, we will be having the 2 vaccines, and so those vaccines, it's much more helpful if we will just go and take the vaccine on the basis of the arrangement that we have made, because that way it makes it easy for our logistics and so on. But our logistics are going to be based on the convenience of maintaining the stability of that particular vaccine. So as I indicated, we might want to deploy more the temperature-sensitive vaccine in the urban settings, and then the ones that are stable at ordinary temperatures, such as 0 to 8 degrees, we could deploy those in the rural areas. So it makes it easy for everyone to understand that the best has been made available for all our people, and therefore what is available, they should actually work with us to make sure we use it that way. Then, Honorable Ndongeni, we don't anticipate that there will be health workers who will refuse to go to frontline work simply because they are not vaccinated, for 2 reasons. Our health workers have been committed when there was no vaccine. They never refused to go to the forefront, because you can prevent the spread of the infection even before the vaccines came. There was a way of doing so. There was good training, there was good protection. So a lot of them knew how to deal with it, because it's their specialty to deal with infection and invisible organism, preventing its spread. It's their specialty as the health workers. However, in the starting of the vaccine, if you noticed on the slide by Honorable Pillay, they indicated that we start with those who are exposed. So people who are working the COVID ward must go first and get vaccinated. People who are in the areas where the chances of early infection where there's a high likelihood of COVID in PUI wards and so on, must get vaccinated early. And then we move on, ICU and all of them. And then, of course, all those in the hospital must be vaccinated. So our approach is basically to say, yes, you're all at risk, but we will also prioritize those who are at higher risk. So we shouldn't feel that there might be a problem at that level. So then Honorable Vacha raised the question of teachers. When do we get them to participate? In the next phase, starting from April, we'll actually be ready when the first batch of large numbers of vaccines will be coming. That will be our phase 2. Notice that it would have started a month or so earlier than what we had originally planned. And so we're doing so because we just want to make sure that all our people feel they are properly protected. And so they will be part of that.
What Health Minister Dr. Mkhize briefing Parliament on the plan by government to vaccinate over 1.1 million people by the end of March, and of course updating Parliament as well about the rollout program of frontline workers as doctors and nurses were the first to receive their jabs. We'll now take a break, and when we return, we take a look at some of the news that have been happening in the country as we'll be starting off the program in the next hour. Don't go away.